Good evening, friends. Today we have a very eminent guest with us, Mr. V.S. Bhaskar. He was the Additional Chief Secretary of Assam. He had a stellar career in the Assam cadre. He was the Health Secretary, one of the most prestigious appointments which he had. A lot of people are curious to know about the challenges which he faced in Assam. How did he solve for those challenges with his stellar team, including Mr. Himanta Biswa Sharma? And how did he go about all of those issues, and what does he see the future of healthcare? Because once he has handled such incredible challenges, there will be very few people in India who would be able to give us an in-depth understanding of what will happen and how can our Prime Minister Modi's dream of Viksit Bharat by 2047 have a significant part of health, and how can we revolutionize health from primary health centers up to the highest level of hospitals. So first we will be asking Mr. Bhaskar about what are the biggest health challenges in Assam when he joined there as an health secretary.
Thank you, Chandrahas. Firstly, showered a little encomium on me by calling me an eminent bureaucrat. I am not anywhere near that. But be that as it may, I would like to put the whole problem in perspective. If you see the health infrastructure of India, it is considered inadequate, but if you see the figures, you will be staggered. We have about 1,69,615 sub-centers, 31,882 primary health centers, 6,359 community health centers, 1,340 sub-divisional centers, 714 district hospitals, 362 medical college hospitals. By any stretch of imagination, this is a huge infrastructure because the number of doctors required to man these institutions, paramedics, technicians, pathologists, health workers, ashas, the whole numbers are a real problem. Now, to get so many people who are qualified, who are capable of delivering services in an appropriate manner to the needy is one of the biggest challenges. Apart from that, health sector has certain responsibilities incumbent automatically upon it. First, it should be universal coverage. Number two, the out-of-pocket expenses must not be much. It should be almost zero. The insurance sector must cover all the poor sections of people so that they won't become bankrupt after getting treated in any hospital. Then we should have qualified manpower. We should have doctors as prescribed by the World Health Organization, that for 1,000 population, how many doctors are required, but we are woefully short of that. Then funding. India spends around something like 1.7% of its GDP on health sector, whereas the minimum prescribed investment on health sector should be 4%. If I may quote, United States of America spends 17% of its GDP on health sector. It's a different matter that the health delivery may not be the best in the world. I would like to say that the best health sector functioning comes from Switzerland, from Sweden, from Norway, Finland, Japan, South Korea, Germany, and such countries. They invest heavily on health sector, and there is all ingredients of universal health coverage, affordable, efficient, competent health service delivery comes out of this investment. So the challenge we have is to firstly sustain the infrastructure which we have and expand it. Also, I gather a feeling that our health institutions are not distributed in the manner they should be. Like a large number of people may have to travel lot of distance to access a healthcare center. In some cases, they may have to just walk few furlongs or let's say yards to reach a health institution. So this skewed distribution is a problem. How it can be corrected, I am not sure, but definitely it has to be addressed. And maintenance of the civil institutions, the civil infrastructure, the equipment, and to keep the manpower trained, updated, and motivated and committed. These are all the challenges in the health sector. Although I must admit, the average life expectancy at birth was 32 when India gained independence in 1947. Now it has risen to 70, which is a dramatic rise. Also a challenge. The infant mortality rate, which was about 38 or 39 in 2014, has come down to 24. You may feel that the difference is not significant, but if you take the sheer numbers, this is very significant decrease. The maternal mortality rate is calculated against 1 lakh live births. It used to be around 83 and it has come down to 33. The crude birth rate also has come down. We have made strides, we have made achievements, but there are also almost seemingly insuperable challenges in health sector. And government is trying its best. They have introduced National Health Mission, which is providing funds. It has given enough autonomy to the states to function without any interference. That's why some states have infrastructure which actually you will feel proud of it. For instance, I have got some pictures of health institutions in Assam. The present Chief Minister, Dr. Sharma, was in health sector for a long time. Even now, I am sure he is looking after health sector. If you see the health institutions there, they look very almost corporate-like. They are monitored well. And he is also posted a professional doctor as the Mission Director of National Health Mission. That makes a lot of difference. So, positioning of administrators who are well qualified to handle a technical subject like health department, dealing with intellectuals like doctors, requires a person who has some basic understanding, if not very deep understanding. If a person is a doctor himself, that's a bonus. So, these are some of the challenges, like posting good position, good officers with knowledge in health sector, deep knowledge in health sector, or at least the capacity to understand the issues of health sector. Finding enough number of doctors, making sure they attend to their works, finding enough number of technicians, paramedical staff, nursing staff, etc. So these are challenges, and as I said, universal health coverage, no out-of-pocket expenses if possible, and non-skewed distribution of health institutions, good insurance coverage to the patients, etc. These are the challenges according to me. So.
Thank you, Mr. Bhaskar, for an immensely detailed introduction to the challenges in healthcare in India. I am sure the audience has learned a lot from his experience about the various amount of challenges and how the infant mortality rate, the number of births, the quality of infrastructure in hospitals has been transformed in the last 30 years in Assam. So Mr. Bhaskar, we would like to know from you, one of the biggest challenges we face is that the doctors in the rural setting, primary health care centers, are overwhelmed with work. Of course, we all know that the problem is that we don't have enough doctors. How can we solve this problem at a state level and at a center level, at a short-term level and at a long-term level? We would like to know.
Yeah, that's a very good question, Chandra asked. The issue is, in fact, converse. There is no rush of patients in the rural hospitals. The reason being, the absence of doctors, which I have noticed is rampant. Even if they are posted, they don't go. They sit at the state capital or district headquarters, and then they don't go. So therefore, the patients find no point in going to those institutions. So what we call as health rationing has taken a big beating.
Okay.
If you, for a small fever, which can be sorted out at a PHC level, or even a ASHA worker can dispense a Dolo or some paracetamol, they go to Guwahati Medical College Hospital or at least a district hospital.
That's crazy.
So what happens is, the higher the level of the health institution, more is the pressure on them and less is the efficiency that comes out of them because of this pressure. For example, Guwahati Medical College Hospital has a sanctioned bed strength of 1400 beds, but on any given day there will be 3000 people there.
My God.
So this is a problem of health rationing, which is a big challenge really. The challenge lies in making the doctors stay put where they are posted.
So this is incredibly great to know. Nano, I'm sure most of us didn't know this. But how can we solve this? As I see, there are three problems here. Why are the doctors not going to the primary health centers? How can we incentivize them? How do we ensure that the people in these small villages and towns trust their local primary healthcare center doctor? And how do we ensure that in case of emergency, let us say 1400 beds and 3000 patients are coming, I'm sure it will take a long time for us to get these behavioral changes done. So how do we in the interim manage these things while in the long term we ensure that primary health centers become trustworthy for the villagers and the townsfolk?
Yeah, when see the National Rural Health Mission, which has been now re-christened as a National Health Mission, has given us the scope to give reasonable amount of salary to the doctors. The young MBBS people now probably get about 40 to 50,000 rupees a month. So there is no reason why they can't go and work in rural areas. So I have a feeling that it has 1 year of rural service has been made compulsory to confer the degree on them. So partly it will solve the problem. But what happens is, everybody wants to stay in their respective homes and establish a clinic, earn whatever they can, live whatever life they desire to have. So in the process, the patient gets a lot of beating and he is forced to spend money. After all, for somebody who is, let us say, from a district, Nagaon, coming to Guwahati, waiting, not getting admission, staying in a hotel, all these are expenses which they can't afford. So ultimately what is happening is, these patients may get treated, they may get, they may get treated, they may be rid of that whatever ailment was haunting them, but the recovery process requires proper nutrition, the post-intervention care. All these go for a toss because he or she can't afford. They would have, by then, some of them would have disposed of their properties, which they may have given on lease or rent. So there is complete lack of money.
So this is quite interesting that that the government cannot deny medicine facilities to people who are coming to the city center. It's a big issue that medical facilities in the cities are being overwhelmed. Maybe we should also look at it from another point of view, that in COVID we saw that beds got completely saturated. we are not prepared for a pandemic. Maybe the solution lies in ensuring enough backup medical beds, medical hospitals and doctors in the city. It would take few years, maybe a decade, for us to get a behavioral change that people start going back to primary health centers. But till then, why cannot we massively build number of hospitals and recruit a lot of doctors in the major cities? And why are we not able to allocate enough health budget to do this? What are your thoughts, sir?
Yes, first and foremost, from the state's own budget, they are spending about 1.7% of GDP, which is inadequate, as I told you.
Definitely.
And the National Health Mission is supplementing by way of huge amount of funds. Therefore, I think at this point of time, I would hesitate to say that there is shortage of funds. It is more of marshalling your resources in a proper manner to make sure that the patients get the best of the care. As regards, keeping spare ventilators, you see, COVID-like situation required isolation wards, ventilators, costly equipment. You can't just buy them and keep them in anticipation of something coming. So that's not the solution. The solution is to give quality care in all the government institutions. For that, the district magistrate and all his subordinate officers must keep on inspecting these health institutions to make sure doctors are there, and then take strict action where proper services are not being provided. In fact, when I was the principal secretary and additional chief secretary, I used to see health institutions so much so that doctors at the level of PHC used to call me at whatever time and take my advice, or lodge a small complaint, whichever it is, or some difficulty, everyone's, and which used to be addressed. So, health secretary should not sit in his chair and clear files. He should go around. He should go around and see what's happening. I have, to my utter shock, I have seen some of the equipment we supplied under the National Health Mission, they were not even opened.
My God.
Like ultrasound and very high-ended X-ray, that kind of thing. And even some places CT scans were not working. So much so that the present Chief Minister, Dr. Sharma, has empaneled some private diagnostic centers to do the job so that this issue does not arise. So there are ways to steer around our difficulties, but all of them require committed bureaucracy who are committed to healthcare. After all, health is wealth.
Yes.
If people are healthy, the state becomes wealthy, productive.
Yes.
Now, that's not the case. People are not in Assam because they are rice eaters. Incidence of diabetes, cardiovascular diseases is very high. And also diseases pertaining to liver, kidney, they are also high. So, basic problem lies in an all-round approach to make sure that all the gaps in the circle are closed and we provide a holistic treatment to all needy people. Rich people, anyway, there are corporate hospitals there, they will take care of themselves. But we are talking about the rural population, innocent people, innocent lives are being lost. Those that has to be prevented. Now I feel that some good times are being seen now with a good team. I personally know who is heading the health department and who is heading the National Health Mission and who is the minister concerned, the Chief Minister himself looking after health. So this is about Assam. But the problem is I have worked in Andhra Pradesh also. Yes. And in Andhra Pradesh, some of the institutions I have pictures, they are abominable.
Right.
You can't enter those institutions.
So as we know, Assam faces unique geographical challenges. The Brahmaputra floods massively cutting off communications. Incessant rains are there, lot of issues of malaria are there. So in these challenging months of monsoon and post-monsoon, how did you ensure that Assam reacts immediately, the repairs are happening, immediately the doctors are taking care of a flood of patients due to malaria and other such diseases. What are the challenges unique to Assam and how did you handle it? We'd like to know.
Yeah, Assam faces about 2 to 3 waves of floods in a year, which is quite a bit, I must say, for any state to handle. Because the entire Brahmaputra Valley, all the districts are either in the north bank or in the south bank. All of them are affected. So we have a disaster relief manual, a disaster management agency, and they are ready. And then the state disaster relief force also is there. It's called SDRF. It's there. It's a national concept actually. All these people are there. First to rescue the people who are marooned, and number two, to admit people who have injured themselves or who have contracted a disease. They are shifted to hospitals. Sometimes we requisition school buildings, office buildings, whatever is required, they are requisitioned by the district magistrate and beds are positioned there. Doctors go there and treat. It is an enormous task because no state can afford this kind of calamitous situations 3 times a year. But Assam has been managing, and the bureaucracy there, right from the cabinet ministers to IAS officers, police officers, the subordinate bureaucracy, they are used to this situation, and they have to toil a lot to make sure that a holocaust doesn't take place. That is, the number of lives lost should be minimized, and that's what Assam tries to do every year. They have a well-oiled machinery for that.
So what are the most difficult challenges in dealing with the inept bureaucracy under you? Why are situations like a brand new CT scan machine, ultrasound machine kept under wraps? Why won't the average administrator at a medium to low level have that sort of zeal to work for the Assamese people? After all, they are dependent on them. So I would like to know, what are these challenges in managing manpower, and how did you motivate them, and how did you inspire them to do a fabulous job even at the lowest levels of administration?
Well, just speaking of my personal experience, when I have to deal with people who are lazy laggards and who don't want to work and who want to while away their time, the only way is to do the work yourself and demonstrate to them that you are willing to work. What is your problem?
That's great.
So I used to do that, and fortunately, by God's grace, I hardly encountered people like that.
Wow, that's unbelievable.
Because at least the team which I worked with throughout my career somehow had a feeling that I won't spare myself, nor I would spare them. But I would shower plenty of love and affection, and if they need any personal help, I used to intervene and help them. So I think one has to build some kind of personal rapport. Okay. This business of bureaucracy is not all about flaunting position.
Absolutely.
It's about actually building a team.
Great.
Making a family out of you, those who are working with you.
Yes.
They must feel belong.
Yes.
They must have the freedom to walk into my room anytime. This is what I used to see. I used to do. That I think that's a nice strategy which everybody must adopt. There is nothing like, I am secretary to government, so deputy secretary should wait outside for 1 hour. It's a stupid kind of concept.
So while people close enough to Guwahati can come to Guwahati, what happens to far-flung areas such as Tinsukia, Digboi, Lekhapani, areas much closer to Arunachal Pradesh? They cannot afford to come to Guwahati. How does the government solve for that? And after so much of development in terms of awareness of modern medicine, have people in Assam stopped going to village quacks and ancient Ayurvedic medical practitioners?
Yeah, I think that the charlatans and quacks and all, I think that's not a big issue now, because health institutions have spread all over the state. Now we have a medical college hospital in Silchar, so the Barat Valley south of Assam is covered. Then we have Dibrugarh Assam Medical College Hospital, so all people Tinsukia and Dibrugarh, Sibsagar, people can go there, all tertiary care. But everywhere you have primary health centers, everywhere you have community health centers, district hospitals. So the question is, people not willing to go to lower level institutions is the problem. Because there are many minor issues, a small cut or an injury, they rush to the Assam Medical College Hospital. Now, that's a complete waste of medical resources. I think to a large extent the coverage itself has been addressed, but people are not going to the appropriate institutions, and there is probably we have not been able to discover what kind of strategy is required to make sure that they do go to the right hospital. It's not easy for an ailing patient to be forced to go to a place or prevent him from entering a hospital. Denying treatment is not allowed in medical ethics. And as regards emergency services, we have one of the best medical emergency services, which is called as 108 Mrityunjay services. And the average time to reach a medical institution in emergency situations is about 18 minutes. In a place like Assam, with somewhat about 40% bad roads and rural roads, etc., still they are maintaining an average of 18 minutes. That was my last known figure. I'm sure better people have now probably running this situation. So emergency care is quite fine, but medical rationing takes a toss. That is the issue.
So we would like to know that when you joined Assam, pre-Bhaskar era, post-Bhaskar era, what were the challenges which you faced, and how did you completely change the face of Assam healthcare? Once you left, which parts of Assam healthcare were totally transformed? Like a person who had never seen the years of your tenure, imagine he just came after and he was like, oh my god, these things have changed. So from his lens, how would Assam healthcare would have been changed with you and your stellar team?
Well, I won't say that there's something magnificent which I have done personally, but before as I joined the cadre, one of the most difficult issues which the state was facing was finances. It didn't have money to actually even pay our traveling allowance, so people were avoiding visits to Delhi. Not going to Delhi means you are losing some grants, you are losing some funding, so those kind of problems were there. And at that time, the separatist organization RUFA was at its peak, and we had problem in terms of our own personal security, but then being junior officers, we were not given any personal security officers, so that was one challenge. But in terms of administration, what is the use of actually writing in files when there is no money?
Right.
So money was a major issue. Later on, slowly, the finances have improved after the changes in the political dispensation at the central level and the state level. And we had a very progressive Chief Minister, late Tarun Gagoji, who had a forward-looking mind. So he gave free hand to most of the bureaucrats. So I had worked in one of the most extremist affected areas, so it was engaging into attention. Developmental activities were obviously were put in the back burner, and we had to look after this security issues. But later on, that slowly vanished, and now, at this point of time, I would say Assam is a peaceful state. Assamese are, and the various, not just Assamese, the residents of Assam, various types of people are there apart from Assamese. All are peaceful, peace-loving, and very, very lovable people. They're affectionate, easy to deal with, easy to satisfy. That also I consider a slight downside of the state, because when people are easily satisfied, then you don't perform as much as required.
Yes.
So that's the situation. Now I would say that Assam is in good hands, and it was in good hands. I think it is continuing, and a good band of bureaucracy is in place. I know some of the youngsters now who are highly qualified, highly committed. In fact, I would say that Assam is one of the best cadres, because the officers do original work. They don't depend on the subordinates to put up a fight. Like, if I am asked, I am not junior, or was I any junior even 15 years ago. So, but then, if a government order had to be issued, I would never ask my superintendent to put up a draft. No, I would dictate out to my steno. I would correct, send it to CM, get it approved and issued. So that original capacity has increased. That kind of change has taken place.
Okay. So as we know, Assam has one of the highest rates of snake bites, because it's surrounded by mountains, it's a hot, humid climate. A lot of villagers, farmers do not wear footwear, they sleep on the ground. So what sort of measures did the government take in terms of educating the people, in terms of solving for the emergency first 1 hour, providing anti-venom, as it's very expensive, and how is the situation now compared to what it was 20 years back?
No, I have not encountered this kind of situation during my career there, because most of the snakes are non-poisonous. They are water snakes. They are snakes which move around in swamps, marshes, and all that. They just bite, and you can see fang marks. That's all. They don't put venom into you. And as regards venomous snakes, they are very, very shy of civilization. They don't come anywhere near us. Okay. They are away. They don't come into a village. It's a rare occasion if a cobra enters a village. Okay. And people do consider the snake as a auspicious reptile, and they don't generally harm it. They catch, and we are not supposed to harm it. We are supposed to catch, hand over to the forest department. When they bite, most of the hospitals have snake venom, that anti-venom. So people are not dying anymore of snake bites. And one odd case may happen. That can happen anywhere in India, like you said.
And what about stuff like malaria? Because it's a very hot and humid climate. There are many mosquito-related medicines issues in the state. We would like to know more about some unique issues in Assam due to its climate, flora and fauna. I am just giving an example of malaria because that is what is my knowledge. How did you encounter them, and how did you develop Assam specific interventions which are not there in the rest of the country?
You know, Assam, definitely, as you said, because of the humid conditions, hot weather, mosquito bites is quite, it's in epidemic proportions actually.
Oh my God.
So malaria takes over, malaria creates problems, creates deaths. So government supplies medicated nets free of cost to every individual in the state. rural areas so that they are not bitten by this thing. So to a large extent now malaria, the incidence of malaria has come down. Not only malaria, even dengue fever also is passed on by mosquitoes. So by giving medicated nets, Assam is circumventing this problem, and that's a good initiative, I suppose. There is no other way you can do. You can't prevent these trillions of mosquitoes roaming around. You can't control. The only way is protect people from them by giving them medicated mosquito nets.
Right. So we also have heard that you have served tenures in Telangana. You have looked at NIMS, one of the most prestigious hospitals. So I'd like to know something more about how did you handle the challenges which in Telangana, which would be so much different from Assam, and coming from Assam, focusing on a metro city, it would have been slightly different for you. How did you manage that, and few achievements of your tenure in NIMS?
Well, actually, when I came here on deputation, they posted me in health department, and my boss, the principal secretary, was Mr. Retd and Sharma of 1974 batch. He is one of the most bright, intelligent, compassionate, encouraging seniors one can imagine to have. So he gave me free hand. I used to handle all central programs. I used to handle various legislations and all. I deliberately did not want to do transfers and postings because it will detract me from the major work. Those transfers, postings, the doctors hover around all these people, they create problem. So, since I belong to Hyderabad and my father himself was a 1956 batch officer, I had the encouragement, knowledge and patronage from very senior officers who always used to encourage me. Apart from that, the then CM, and I worked under several CMs actually. When I joined here on deputation at the time, late N.T. Mora was the Chief Minister, later on followed by Channareddy, then also we had Chandrababu Naidu. I worked for a long time, YSR and all, I did not work. So all of them, somehow they knew me as son of my father, and they didn't find me incompetent. They found me rather matching up to their expectations, and they reposed a lot of trust. And I think I made fairly good contribution in terms of drafting many legislations, creating nursing schools, then visiting various hospitals. And NIMS was something which came as a bolt from the blue. Suddenly, Mr. Chandrababu Naidu, he called me and said, "You take over NIMS." I told him, "Sir, I am not qualified to handle such kind of hospital, because all are super specialists. If I blunder around, then your name also get tarnished unnecessarily." But he wouldn't listen to me. He said, "No, I don't think you will do any blunder. Nothing great will happen, you go and join." I stayed for about 4 months only, but in 4 months, numerous incidents took place which gave me lessons in life, and particularly visiting VIP, where a VIP joins the institution, what kind of expectations they have. I had seen firsthand, and I had learned how to handle all this. It was a good experience. Probably I can consider myself the youngest Vice Chancellor ever in the world. At 35 years, I was the Vice Chancellor.
Heard a lot about Assam, we have covered about Telangana. Now we'll discuss about the nation and its future. As he had mentioned in the beginning, America spends 17% of its GDP on healthcare, while we spend 1.7%, 2%, 2.5%. Is this ever going to solve the great issues which our country faces? We have got waiting lists spanning months in the major municipal hospitals in the cities. A lot of middle class and upper middle class people are going to corporate hospitals. How can we solve it at a 50,000 level feet, at a Prime Minister's level if we have to solve? So my question to you is, if you were the Prime Minister of the country, what are the 3 major initiatives and revolutions which you would get to change the direction of our healthcare and make it actually a Viksit Bharat by 2047?
Yeah, I think firstly, becoming a Prime Minister of India and handling India itself is one of the most complicated subjects. But I would say that come what may, the allocations to health sectors has to improve. There is no alternative to that. Number 2, corporatization of health sector must be encouraged. More corporate hospitals must come, and there should be a tie-up with the government that any poor man goes admit, we will underwrite the expenditure. That means you have to have an insurance, universal insurance. So all those points which I mentioned initially, they have to be taken care of. Universal coverage of health.
Okay.
No out-of-pocket expenses.
Right.
Robust insurance system. Tie-up with corporate hospitals. Regulation of the corporate hospitals so that frauds are minimized. These are most important things. And of course, we don't have proper trauma care on the highways. So we have to have trauma care centers on the highways so that casualties are minimized. And I think this would be the major issue, and the Indian Medical Commission must be activated to see that only good faculty is positioned in private hospitals also, private colleges also, and in government colleges also. And periodically we must upgrade our own medical personnel to see that they are properly oriented, because their behavior towards the patients, the attendants, actually requires a lot to be done according to me.
So we also know that the number of medicine graduates, capable medical graduates, is extremely low for a country of our population. What can we do to ensure that we can open 1,000 AIIMS, but to be equivalent to AIIMS Delhi, to be equivalent to AFMC, R&R Hospital, 92 Base Hospital, Srinagar. We have the finest doctors in the world in these 3 hospitals. How do we ensure that we open 20, 30 AIIMS, we open smaller government medical colleges? How do we ensure the quality of the students there is up to the mark? And how do we ensure that the number of doctors who are coming out are enough to take care of the needs of 1.4 billion people?
Yeah, the government is trying its best to establish more and more medical colleges. Since it's not possible for the government to go on establishing medical colleges, they should allow the private medical colleges also to come. The only challenge is, where is the faculty? Who are going to teach? The professor, the student is as good as the professor. But when the professor himself is wanting in his knowledge or commitment, then there is a problem. I know for one that sometimes some of our private medical colleges are not adequately staffed. So the students find it tough to manage. They somehow scrape through. They are not actually going to become any competent doctors. So what is happening is most of our doctors are going away and studying, not now maybe, to places like Ukraine, to United Kingdom, USA, and even to some other not so famous countries, but they are going and studying there, obtaining degree, and working. So it's not easy. It's not easy to take care of 1.4 billion population. Whatever you may do, you don't have a magic wand to produce. An MBBS doctor nowadays, people don't even, villagers also don't go.
Exactly.
They want a specialist. So how many specialists can you get? Seats are small because if one professor is there, he can have only 2 candidates under him. So that way it's a very difficult challenge. I don't think I can really come up with any magic solution on this. It's a humongous problem we have to face. But what can be done is utilize what you have to the best possible extent. That must be institutionalized. The concerned bureaucracy must be galvanized to motivate all these people. Inspect medical institutions, pharmacology institutions, nursing colleges, nursing schools, various other pathological labs and all those things which people should inspect. But unfortunately our bureaucrats are chair bound. They are room bound.
It's been an amazing discussion. Now, to begin the closing process, I'd like to ask a question to you. For our viewers, some of them might be aspiring UPSC aspirants, some of them might be right now working in the administrative services. What is your message to a young IAS or a state administrative service officer who is going on this path of becoming a health officer and eventually principal secretary health? What would you like to tell them from your incredible journey?
Well, you asked me what I would advise to the newcomers into the service. First and foremost, that feeling that one has got into the IAS or IPS or any of the central services should not bolster the ego so much that they think that they have scaled Himalayan heights. That's not the issue. The issue is government has given you an opportunity to serve the people in a very sincere manner, and you will be sworn by the Constitution of India. So you should, and we are a parliamentary democracy, and rule of the law is the only limb on which the parliamentary democracy can run. Although we have judiciary, executive, political executive, and the legislature, the point is rule of law is very important. So all the civil servants who join must make sure that they follow the rules. Once they follow the rules, the message goes that this man doesn't tolerate anybody violating rules. So it starts right from the level of a sub-collector or a sub-divisional officer. So a good conduct, working within the framework of our laws, implementing them fairly, justly, and in a timely manner makes a lot of sense. Nowadays, a tendency has come that bureaucrats are getting close to the political executive, much to their disadvantage, I should say. I think that habit they should shun and work very professionally. So, I would say IAS being the most premier service must set example at their level. Then things will start flowing down. So a trickle down effect will take place. It is not that a clerical staff should teach an IAS officer how to be honest. If that stage comes, then we are doomed. We should never allow that to happen. So basic question is sticking to the fundamentals of our system of governance, keeping the interests of people uppermost in one's mind, respecting the rule of law, being of conduct which others can imitate, treating seniors with respect, juniors with kindness, And most importantly, bureaucrats must be in personal touch with people. They should tour around. They are not supposed to sit in their gaddis, in their chairs, and then keep signing files and thinking that they have cleared 200 files and that's a great job. I don't consider that a great job at all. One should go visit. The whole day they must go on visiting institutions, meeting people, shaking hands, finding out, sorting out problems. In situ sometimes, then and there itself you should sort out many problems. You can, in fact. So that should be done. Then do your file work promptly. Set example. This would be my advice.
Thank you, Mr. Bhaskar. It's been an amazing interview with you. We have covered so many different topics in so much depth. However, I feel we have got hours more of content if we really deep dive into the nitty-gritties. Due to the lack of time, we are ending our first interview here. Now, friends, I'd like to talk about the purpose of our channel. Hitler really wanted to preserve the brain of his generals. Imagine 60 years of incredible experience the generals had, and it is going a waste. The technology wasn't there back then, but now I believe our retired bureaucrats have seen so much. Such intelligent officers with such vast experience have retired, and there is no medium till now for them to give back to the next generation. How will young IAS officers, young central government officers learn if not from a compendium, an encyclopedia of the knowledge of their predecessors? So what we are trying here is bringing eminent personalities, asking them the right questions, and ensuring that we build up a library like an Nalanda and a Takshashila of IAS, IPS, IRS officers, so that this precious knowledge will be preserved for eternity. And why me? I am an eminent writer on foreign policy and Indian Army. I have been writing on Quora, where I have 33 lakh views. One of my articles was cited by RAND, which is US Defense largest think tank. And I have been reading on multiple topics for many years. So I am like a jack of all trades, where I can speak about a plethora of different topics. And it's very important to have an interviewer who has some idea of your field. So that is why I urge you and I invite you, all eminent personalities and top bureaucrats, to please come on our channel and let us have an exchange of views. Let us have very interesting discussions on what you have done and where is the future for India, and how can we all play our part in enabling a Viksit Bharat by 2047. Jai Hind, Jai Bharat.
Very